Thanks so much. I appreciate that kind introduction. I'm really not that smart. I'm just pretty smart for a congressman. Yeah. Very low bar. Tough topic today. I'm going to talk about downside risk. That's something that no one wants to think about, but everybody needs to be protected from. The first rule is don't screw up. Whatever healthcare company you're in, your potential for humiliation and disgrace is much greater than you want to realize. Talking about criminal laws is not funny. It's a particular downer at a healthcare conference because you're legit. You got nothing to worry about. It's insulting to even be thought of as a possible criminal, right? But that's the trouble with these laws. You can be as ethical as your grandmother would love you to be, and you can still be caught by the sheriff. So how do we fix this? Look at what some veterans of the industry talk about. Everybody does it. These are all the excuses. Let your lawyers worry about it. Just the cost of doing business, bad publicity. And there you are on the slippery slope toward real legal trouble. So for the newcomers, be optimistic and cheerful. The veterans know better. And I'm going to go through some of the veterans' answers to these problems. The overall outlook you should have is how many folks have gone running with the bulls in Pamplona. It's a fun thing to do. In some of my classes at that one school at Vanderbilt, a surprising percentage of my students have already been running with the bulls. And that's fine if you're risk prone and you don't mind the consequences. And you think getting caught by the bull or by the U.S. attorney isn't so bad. You don't often have to admit guilt or wrongdoing. The company pays for stuff. You probably have good D&O insurance. From a company standpoint, it's a one-time charge to earnings. And hey, settlements are tax deductible. That proves right there that even the IRS says it's a cost of doing business. There are companies who've gotten away with the one-time charge thing 20 times. You know, it's almost as regular as rain. But this is sort of the veteran approach to this. It's not fun, folks. It is not fun. So I'm probably getting too personal, right? You know, this is too much of a downer, but I want to keep you safe. I teach at Owen, and my fellow professor, Larry Van Horn, and I say, we do not visit our graduates in prison. You have to handle that on your own. So what's your real risk? Everybody in this room is already a target of bounty hunters. That's the whistleblower system we have in this country where your own employees might have an incentive to get rich by taking you down. DOJ, Department of Justice, is merging civil and criminal matters to make it easier to catch you. And see, the key thing is you can feel innocent while you're doing a bad thing under federal law. So you do not want to be an accidental felon. Even a misdemeanor is bad. And the slide doesn't cover the bottom here. A fraud indictment doesn't mean you're guilty, but it means you're under investigation, but all your neighbors are going to think you're guilty. And guess what? In the law, you can never prove that you're innocent. That is impossible. You can only prove that you are not guilty. But half of your friends are going to think, ooh, where there's smoke, there's fire. This is from a government pamphlet, and this is designed to explain, and again, the formatting is not right here, but basically, there's almost no difference that you can logically discern between the red light, which is bad, 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 the yellow light, which is watch out, and the green light, which is okay. I'm sorry for the formatting here, but this is in all the government literature on explaining to you simply, using a red light format, what's good and what's bad. So are there speed traps for healthcare? Because the government has a huge incentive here to fund the government off of your backs, just like some small municipalities do by catching you for speeding. I don't know if you've ever seen this sign. It says, slow down, the cop hides behind the sign. It's like, this is my speech encapsulated here, helping you understand what's really going on. There's heavy traffic. This was mentioned earlier, and there was a titter that went through the audience about it's such a big pie. If I only get a little slice, I'll be rich. Well, look at all these transactions every day, and every one of these transactions is an opportunity for a government inspector or policeman or prosecutor to say, you screwed that up. It's almost impossible, in fact, to get it all right. So some people just give up from the very beginning. This is from the latest GAO report, 2015, indicating that there's $60 billion in improper payments, and a large part of this is fraud and abuse, just in Medicare alone. $60 billion a year. $17 billion for Medicaid. That's a lot of money. That's called a target-rich environment. This is from the Wall Street Journal. I updated the 2015 number. It seems to be increasing. That's one reason the DOJ has shifted a lot of its prosecutors from drug crimes and things like that to the healthcare industry. So watch out. Don't slip up, because it might be fun to watch that TV show, but it is not fun to be there. Still not convinced? You know, most people think bad things only happen to other people. Couldn't happen here. Nashville is one of the greatest cities in the history of the world, so we're fine, right? It's a fun place to be. This is an awesome hotel. A medicist just moved here. You know, awesome, but you have to watch out. These are trouble spots, and we can make a longer list if you want. Upcoding, overtreatment, short hospital stays. The entire third-party payment system is a disaster. Off-label uses of drugs, paid referrals, physician ownership of designated health services. It's a long list. Almost everybody is involved in one or more of these areas. So how can we get better public policies that would actually end up lowering your risk? It's possible for the government to actually make more money by aligning interests, streamlining the system, and putting you in less legal jeopardy. But so far we haven't done that. In fact, hardly anybody in Washington, D.C. even wants to talk about it. Every year, every law just ratchets up the fines and the penalties. The old model, which most people realize, and some people have taken advantage of, is called pay and chase. The federal government is one of the promptest payers ever under the Prompt Pay Act. We usually pay within 30 days. And then we have to go get the money that's misspent. You know, parts of southern Florida in particular have been fraud areas for years. The Secretary of HHS once visited an office building in Miami, and every business in the building was basically a fraudster. So it's rampant in certain parts of the country. Some states use the state Medicaid program as basically for economic development. If the Oregon study pans out and the 2 years that already have been investigated prove to be the trend, then Medicaid really doesn't help poor people be healthier at all. We spend a lot of money, but it's not working. Private insurance, they have more means of making sure money is not abused. These are history of some of the laws. Again, the formatting is wrong. The first one, the biggest one, this is the only one that HCA lists in its federal filings as an existential risk. But that's back from the Civil War. That was a law that was passed to punish companies that supplied Union soldiers with faulty ammunition. But under modern court interpretations, it's used for Medicare and Medicaid. So watch out. Some of the other laws, anti-kickbacks from the 70s, the Stark laws from the 90s. Some of these laws, the elder abuse laws from 2010. And that's an unbelievably broad law. You have a duty to report if you heard something bad happened somewhere in the organization. It makes everybody a whistleblower. These are lists of some of the Medicare policemen. It's the acronym WAR. But all of these folks have the power to audit you to death, basically. And some of them just can make an automatic referral to a prosecutor. And these are growing like kudzu. This is from the official federal folder. This is where you get to go read the law to see if you're behaving or not. Like, look at these URLs here. That's an amazing list of, like, how could you remember to type any of that in? Is that accessible? You know, this is astonishing. And oftentimes when you go to the website, you see a document that's 100 pages long. You know, under American law and British law, the presumption is that you know the law. How can any human being possibly know all this? And these are just the main statutes. I do not list here HIPAA, RICO, a bunch of the ACA laws, malpractice. It's a field day for lawyers. So how do you visualize your downside risk? I'm going to give you a couple of tools here. If it's bad spin, and this is what every newspaper would put in the headline, false claims is basically lying. Kickbacks, that's bribery. Self-dealing, that's Stark. The good spin is, hey, those are paperwork issues. Or you're paid for referrals, what's wrong with that? Or a doctor goes into business, isn't this a free country? But that's just one way to visualize it. And this is kind of silly, what I'm about to tell you, but this is a way to think of yourself as a fish and or a whale, because you know the whales are really mammals, not fish. The False Claims Act is Moby Dick. There are prosecutors out there who think that you are the great white whale and that they are Ahab and they are going to get you. And in the old days when they're in a little boat, might not be a problem. Today, with your employees as whistleblowers, that's what you face. One of those little spears can be a big problem. Problems with the FCA, False Claims Act. This is the war nature of the statute here. The Afghan war extended the statute of limitations, normally 10 years, to 23 years. There should have been more people rejoicing that the Afghan war is largely over. It's due to the FCA statute of limitations. Who on earth could possibly keep paperwork for 23 years? Well, that's the screwed up nature of these federal laws. By the way here, even lawyers have sued former clients under this law because the pot of gold is so big. The Anti-Kickback Statute, a completely different legal approach. It's not a spear, it's not aiming at a target. It catches every fish in the sea. And the only way to get out of the net is finding a safe harbor. Whoa. That means, hey, you're already caught, guilty or innocent, and you have to prove that you fit a safe harbor. You have to wiggle out through a hole in the net. Little fish find that a lot easier to do than big fish do. Now, this explanation I'm giving you, this would not be approved by any law firm in America. This is way too simplistic. You'd have to go to a 4-day seminar and read 1,000 pages and get a degree in law and blah, blah, blah. But I'm just trying to put the cookies on a low shelf so that real people who are busy in business have a chance to understand it. This is amazing. That net catches basically everybody. Problems with this? A doctor's donut in the lounge can technically be a violation. Any payment for referral is a problem. Any payment. There's a question whether it applies to Medicaid, but that hadn't been sorted out. But this is amazing. Look at this. Most of the medical world is already in violation. Here there's this thing called the Civil Monetary Penalties Law that's newer. And what is it? It's an even finer net. It's basically a combination of all previous ugly statutes, so there are smaller holes. It's harder to get out of. It's redundant, but it's got tighter mesh. It's amazing. And there are quirks and all that if you want to go into the details. What do the star claws look like? They're a lobster trap. You have to be a lobster to fit in that trap. But lobsters walk into these traps every day. That's how you catch lobsters. Lobsters must think that's a beautiful home, something, because that's where all the lobsters in the world come from. But you have to be a lobster to walk in. And I love doctors, but these are laws just targeted at them. And the problems are amazing as a result. Stark himself has told the world he would not vote for his own laws anymore, but they're still on the books. They haven't been repealed. It's strict liability. You're automatically guilty. If a signature is late on a contract, you're automatically guilty. Congress could pass a law tomorrow to exempt all these stupid technical violations. Most law firms in America agree on this, but the law hasn't passed. People don't want to go easy on fraudsters. Because see, again, the psychology is you're already guilty if you're accused. This has ended up being about $8 billion a year in extra income for doctors. And they probably spend that much money in legal fees just to get them out of the holes that they're in. Okay, here we're back to the old basic hook. And that's the way you think most fish are caught. But actually, this is just the HIPAA law. Because the only way to get caught and get in trouble under HIPAA is if you open your mouth. That's what enables the catch. 95% of health providers already fail the security rule. HIPAA is two laws. It's a security law and a privacy law. And the security law having to do with your IT system is basically already non-compliant, almost every firm. But people just blow that off. Hey, everybody does it. And that's that path toward trouble. Many people interpret HIPAA too broadly. It can prevent teamwork in medicine. It can do a lot of other bad things. Just defining patient identifying information is increasingly troublesome. So there are a lot of issues there. Then you get to the antitrust laws. These are the oldest laws of all. And these are designed for manufacturing firms, not for health service firms. The Clayton Act, the Sherman Act, things like that, these are from the Gilded Age. And how do they apply? And have we even figured out in healthcare whether competition is a good thing or a bad thing? Because it can lead to a medical arms race, or it can lead to extreme market power that prevents sensible pricing. So how do you do it? And a Herfindahl index is not the best way necessarily to figure this out. And again, almost all hospitals have a natural monopoly and are grandfathered, so the laws don't even apply to them unless you're engaging in a transaction, and then you have all kinds of concerns. So this is really a clumsy tool to try to solve the problem. If we cleaned up the laws, there'd be less fraud. That'd be a good thing, because so many people who are caught today are not really guilty. They didn't mean to do it. But Congress has changed the laws so much that you don't have to intend to be a bad guy anymore. If you do anything that runs afoul of any of these laws, you're caught, you're nailed. You have to wiggle out of the net. So I'm for the business principles of aligning interests. I want people to make all the money in the world if they're keeping people healthy. That is totally awesome. That's a great way to earn your money. But so often we have business models that are not based on that, but on scooting through various loopholes. There are some relief opportunities for ACOs, for FQHCs, for rural hospitals, but these are not mainstream medicine yet, and some of them will never be. Unless the laws change, right now you are picking your own future. And you can have the corporate jet and the nice life, or you can be, in extreme cases, actually jailbait. The key is here, when you're thinking about health policy and innovation, is we need to innovate the health policy laws, because some of them go back to 1865, some to the 1890s. Some of the newer ones aren't any better, but the cumulative impact is A, impossible to understand, and B, impossible to protect yourself from, and C, really an embarrassment for the United States Congress, because we should have fixed this long ago, and very few people are talking about it. But thank you for letting me be here today. I appreciate the opportunity to come and let me know.
Thanks, Jim. Appreciate it.